Good evening. I would like to welcome to this physical and mental health fitness session, the first in the series. It's an awareness program on lung cancer. And we have with us a Central Council member, CA Manu Agarwal. And then we also have Chairman CIRC, CA Nilesh Gupta, and Chairman Ranchi Branch, CA Praveen Sharma, who has really been a guiding force in for this particular program, and CA Sandeep Jalan, past Chairman of Ranchi Branch. And of course, Dr. Minish Jain, the medical advisor and analyst, is there with us to tell us more, give us insight about the lung awareness, and also answer the queries of the audience. So over to you, Mr. Praveen Sharma.
Thanks a lot, ma'am. Respected Dr. Minish Jain, sir, Director Medical Oncology from Pune. Respected CA Manu Agarwal, sir, Central Council member from CIRC. CA Nilesh Gupta, sir, Chairman CIRC, will be joining us within few minutes. Respected Dr. Amul and Dr. Roshan, medical analyst and advisors. Respected Mr. Abhijit, who helped us a lot in organizing this webinar. Respected Ritu Bahal ma'am, Secretary of Public Relations Committee of ICI, Managing Committee members of Ranchi Branch, and members from all over India. On behalf of Ranchi Branch of CIRC of ICI and Public Relations Committee of ICI, I would like to extend our heartiest welcome and gratitude to all of us for taking out time to attend this webinar. COVID pandemic, as we all know, has taught us the value of health, immunity, and healthy lifestyle. And we all know that all these are real need of the hour. We all say health is the biggest wealth, but when it comes to preserve the same or working towards a healthy lifestyle, we generally avoid the same. And we don't even fulfill the bare minimum requirements for a healthy lifestyle. We do avoid the symptoms and warnings which our mind and our body gives. And what for all this for the sake of work and profession. We might have heard many cases of our members suffering from heart attacks due to excessive stress, especially during pressure times. In the present scenario, almost everyone is directly or indirectly affected by some or the another lifestyle diseases. Apart from COVID, in last year or two, we lost our members, relatives, friends, even a few students against cancer. And in my knowledge, there are so many persons who are still struggling and fighting with cancer. And the major reason for the same, in my view, is the late detection of cancer. This prompted us to work towards the health awareness drive. We have planned to have awareness program at monthly rest and would try to cover the issues related to mouth cancer, breast cancer, colon cancer, diabetes, hypertension, and also how to maintain and keep a healthy and balanced diet. I would also like to name CA Vinay Vibhakar ji of Ranchi, who has worked very hard to get things in place. Like we all, when we try to do some good work, we always attract positive energy and positive people. CA Vinay Vibhakar ji is one of the such positive force to have this webinar in place. And even I would like to thank Dr. Minish and the entire team for organizing this webinar at such a short span of time. I would also like to thank our President CA Nihar and Jambu Saria sir and Public Relation Committee of ICI for giving us this golden opportunity to host this program. I hope this webinar would help us in getting better understanding on lungs cancer and ways to prevent the same. With these words, I would like to welcome you all in this webinar, and thanks a lot for joining. I would also like to request CA Manu Agarwal sir to kindly address the gathering.
Thank you, CA Praveen Sharma ji, the young and dynamic chairman of Ranchi branch of CIRC. Dr. Minish Jain, the eminent panelist, other eminent panelists, and Ritu Bahal ji from Institute of Chartered Accountants Public Relation Committee. And I think just joining CIRC Chairman CA Nilesh Gupta, I think is just about joined. Can't see him yet, but probably joined. So friends, well, today is a different kind of day. It's rare to see chartered accountants and doctors on the same platform. But I can just share some of my views first, that though we do not share many platforms, but we have a lot in common. The first thing which we have in common, well, we look after the health of the nation by ensuring that the economy goes on track, and all the doctors look after the health of all the citizens of the country and ensure that they're healthy and up to the mark and ready to work. We share the same day, Doctors' Day and CA Day, 1st of July. That's a common day which we both share. So that's another similarity. And well, we all are professionals. So we have a lot in common. And today, I would first of all compliment the chairman of Ranchi branch for coming up with such a great idea of basically spreading awareness amongst the CA fraternity. This is probably first of its kind. And probably I think this program will go a long way in helping our members in getting those tips so that we can, if not prevent, at least early diagnose and probably also prevent these dreadful diseases. The name of cancer, as soon as it comes, shivers run down our whole body and we are a bit scared and we do not know what to do. So I'm very sure that this illustrious panel today would throw some light and would help us in leading a good life, a better life, and a safe and healthy life. With this, I thank Praveen ji for inviting me, and I really sincerely hope that this monthly series which he has planned becomes a great success, and all the chartered accountants who watch this series, who are participating in this series, gain a lot. Thank you. Thanks for inviting me.
Thanks a lot, Manu sir, for taking out time his busy schedule. Now may I request our CIRC chairman, CA Nilesh Gupta sir, to bless us with his golden words.
Thank you, Praveen ji. I'm audible. Very respected my elder brother and Central Council member CA Manu Agarwal ji. Respected today's learned speaker and the expert joined Dr. Manish Jain ji, Director Medical Oncology, Ruby Hall Clinic, Pune. Other Dr. Amul ji and other distinguished guests joined in this unique program of health awareness, and my colleagues from council colleagues and the other managing committee member from the Ranchi branch of CIRC of ICI. सभी को बहुत बहुत नमस्कार और स्वागत है इस प्रोग्राम में CIRC की तरफ से सभी का। एंड आजादी के अमृत महोत्सव को हम सब भारतवासी इस बार अपने 75वें वर्ष में मना रहे हैं। इसी कड़ी में जो हमारा एक प्रोग्राम, different programs we are going to organize on the various topics, various subjects in this and this is also a program in this series, and then virtual health awareness drive. So I must congratulate Praveen Sharma ji and his entire team for organizing such a unique program and spreading awareness about the very important topic, lung cancer. So I thank you very much for organizing this program for the member at large. क्योंकि मुझे लगता है कि इस तरह के प्रोग्राम्स करने से डेफिनेटली एक समाज में जागरूकता आती है. एंड इन दिस ईयर वी आर dedicatedly organizing many initiative programs like we can say Kardata Jagrukta Abhiyan and Udyami Jagrukta Abhiyan, and also we have started female member awareness program on various professional opportunities, current affairs program, and आपने जो इस तरह का एक हेल्थ अवेयरनेस ड्राइव लॉन्च किया है तो वाकई में ये डेफिनेटली हम सारे मेंबर्स को हेल्प करेगा. एंड एक सशक्त राष्ट्र की ओर जो हम सब जा रहे हैं, तो उसमें सबसे पहली बात आती है कि हम लोग सबसे पहले स्वस्थ रहे. So without taking much of time, thank you very much for inviting me, and we are eagerly waiting for the deliberation of our guest speaker. So thank you very much. Jai Hind, Jai Asli.
Thank you, Nilesh sir. And really, the institute is working not only in the financial sector, but also in CSR and allied sectors also for the benefit of the nation. Abul Kalam has once said, our past president, late Dr. Abul Kalam ji, that we are partners in nation building. So we all are working towards that. And now, without wasting much time, I would like to hand over the session to Dr. Amul sir for taking forward and for the deliberation of Dr. Manish Jain.
Yeah, thank you, Praveen. I will briefly introduce myself. So I am Dr. Amul Ayole. So I am working as a senior medical advisor in Alkem. So along with me, actually, I have Dr. Roshan Pawar. So he is heading the medical department, and with this, actually, we have Mr. Abhijit Natre. So he is heading the medical oncology division in Alkem. So this is just brief introduction. So Alkem Oncology is dedicated to the breast cancer and the hemato-oncology, and we have biosimilar facility in Zit. So it is this place is at Pune. So just this is the brief introduction of Alkem Oncology. So this is my great pleasure actually from the Alkem to introduce a great international personality, Dr. Manish Jain. So he is a medical oncologist. He is a director, medical oncologist at Ruby Hospital, Pune, and working with the various hospitals in Pune. He completed his MD and fellowship, fellowship in oncology from the PD Hinduja Hospital and Research Center. He is also have fellowship in oncology from the Massachusetts General Hospital, Boston, USA. So he involved the multiple research actually. So he from the start he is involved in the phase 1 to the phase 4 trial, and he has almost 20-year experience in field of medical oncology at Pune. And we know as a doctor we have some social responsibility. On that basis actually, so he developed his own awareness campaign, and this campaign he delivered through the YouTube channel. So he has one YouTube channel, that is the Cancer Talk with Dr. Manish Jain, and there are various videos are there, so based on the various cancers. So you can visit this site also. And yesterday also he completed one Facebook live, so almost 5,000 people joined for his session, and he also conducted every Thursday actually, so such kind of session. Over to you, sir.
Thank you. Can we have our first slide? See, basically, I understand that lung cancer or any cancer is a lifestyle disease. Now, cancer is the most preventable disease one can have. It is only 90% of the things come through our own thing. Like, if you have diet responsible for 30% of cancer, tobacco responsible for 30% of cancer, obesity responsible for 15% of cancer, sedentary lifestyle responsible for 5% of cancer. Smoking is a major reason, but alcohol leads to 4% of cancer. So alcohol is less than sedentary lifestyle. Most of the people, doctors, CA professionals are all sedentary. They do not do exercise. They think that, walking, I did run 10,000 steps. Now 10,000 steps is good. You have done your walking. That will make you feel good, but it will not be an exercise. So a lot of people will be finding it difficult to understand that I'm saying walking is not an exercise. So before we go on to lung cancer, I just wanted to let you know that this is our self-creation. Cancer doesn't come from outside. It is our own body's way of creating it. And COVID can come from outside. Cancer is created inside. Now, how do we create that? First, let's understand what is lung cancer. Then we'll take up each point and how we can change them. Can we have the next slide? See, lungs are basically two spongy organs which are located in the chest wall, which we breathe the oxygen in and release carbon dioxide outside. But the problem is that these lungs are also getting polluted every day through air pollution and through smoking and secondhand smoke and radon, which is getting coming out of the soil. You're digging the soil to create urban lifestyle. You require more space. So you dig, you divide the uranium, it releases radon, which also causes lung cancer. Then you have arsenic, nitric oxide, nitric dioxide, which is coming from the exhaust fumes. You have arsenic in water, which is causing cancers. You have so many chemicals around you, which is creating trouble. And this is all being created by one of us. And next slide. So cancer is basically an abnormal cell growing out of control. So if you irritate the lung every day, then they initially try to repair. So if you smoke, you're taking 60 carcinogens inside and you're irritating the lung. So they want to repair it. So the lung keeps repairing, but one day it gets exhausted and the abnormal cells, they start growing out. Once they grow to a critical number, then they are not being controlled by the body. We are all making 1 lakh bad cells every day, which are having 1,000 cells which can go into cancer for each one of us every day. Now that doesn't happen because we have oncogenes which are promoting cancer. We have tumor suppressor genes which are blocking cancer. So there is a balance going on in our body. So any given time we have 10 raised to 3 cancer cells possibility in our body right from birth. Once this number crosses a critical level of 10 raised to 3 and it goes to above that, then it becomes a subclinical cancer. It gets detected only at 10 raised to 8. At 10 raised to 9, it becomes 1 centimeter. At 10 raised to 12, we die. So when a cancer gets detected, mostly it gets detected in advanced stages. Lung cancer is a very silent disease in early stages. Only 20% of cancers will get detected in early stage 1 and 2, where it is curable. But most of the cancers will come in stage 3 and 4 because they become symptomatic only at this. You will be surprised to know that there were more than 2.2 million cases in 2020 for lung cancer alone in the world. Every 15 seconds, one patient getting diagnosed for lung cancer, and every 18 seconds, one person dying of lung cancer. And if you stop tobacco in the world, 90% of lung cancer will be gone. So there will be no discussion on lung cancer. So if you don't have, but tobacco being the most important source of revenue to most of the governments, it cannot be stopped. And in fact, there are people thinking that let 15 lakh people die, but there will be more people surviving out of the taxation of tobacco. Now there can be always a debate to this. So I won't go into details of that, but that is what, if we understand that tobacco is bad and we should give up, we should have awareness drive, we should have awareness programs like this, and we should start teaching our kids in school where we can train them what is good and what is bad. We generally don't discuss these things in school. So they get addicted to tobacco, and that is where things start bad for them. So it is just a teenager thing which starts as smoking, and then they want to remain in the group, they continue to smoke. In a 18-year study, what has happened, what we have seen in the world, that male smoking or cancer rate is declining. The female smoking rate is going up. So you'll be surprised that the lung cancer rates have dropped from 7.6 to 6.7%. For females, it has gone up from 2.5 to 4.1. There are more hookah bars. You will find more females attending that or smoking because of the stress, because of the work pattern. It may not be that much in India, but it is quite common outside India. But even in urban societies in India, we are seeing that there is a rise in female smokers. So 1 in 4 deaths in the world because of cancer is because of lung cancer. So it is more than breast cancer, prostate cancer, and colon cancer deaths put together. So that is the kind of big problem this lung cancer is causing. Now, as I said, that there are two types of lung cancer which are there, which is like small cell and non-small cell. 90% plus lung cancer of small cell type are only because of smoking. They do not happen for any other reason. So smoking and small cell directly linked. For non-small cell lung cancer, 85% of lung cancers are linked to smoking. But a lot of young females are getting this cancer. Now, there may be various reasons to this. Yeah, we can go to the next slide. So tobacco, as rightly said, was introduced in our country from outside. And these were Britishers and the Portuguese who brought this, and the addiction went on. Now, there are 16 types of cancers which are linked to tobacco. There are 60 types of carcinogens in the cigarettes and 4,000 total chemicals out of this. Now, there are a lot of things which are happening. People are trying to go for e-cigarettes. They think that e-cigarette is going to be a better option. No. E-cigarettes also are equivalent to these cigarettes. So if you have one electric cigar, it will have 20 cigars which will be there. Out of that, 200 puffs in it. But there are VOCs, volatile organic compounds, which are getting secreted even out of electric cigarettes, which are equally dangerous, or they may be, you may compare that this is more, that is less, but they are also dangerous. They are not good. So you should not be. And 16 types of cancer, whether they are stomach, oral cancers, larynx cancers, esophageal cancers, they are all because of smoking. Now, if you are smoking and taking alcohol, or if you are smoking and working in an industry like asbestos, beryllium, or any other cadmium and those things, then your risk per year is increasing by 7%. So your lifetime risk is increasing if you're working smoker and working in this. So your risk is 7 to 14% increased per year. So if a person is having both the things, then there is a sure shot he will get a lung cancer. And as I said, can we have the next slide? So these are the death rates from lung cancer. Passive smoking also causes almost half the chance, but there is a half chance. And especially passive smoking is important to be stopped in offices. It should be stopped in lobbies of a residential area. It should be stopped in restaurants, because you may not be smoking, but somebody has smoked and he has left those things for you. So you are at risk. So don't think that, I'm not smoking. Even if you're not smoking in an urban society, if you are moving, if in urban city, if you're moving, you may be smoking somewhere around 5 to 15 cigarettes through the pollution, what we have in our cities. If we have to really do a drive, and if we have to give something good to our next generation, then we should put the nature into right place. We should plant more trees so that they create more oxygen, they take up this carbon dioxide, and they create a more healthier atmosphere or situation for our next generation. Next. So the incidence of this cancer is 75,000, and the prevalence is like, collection of all the patients live and new. So that is almost like 1,39,864. The mortality of this cancer is very high. If you detect this cancer in late stages, especially if you get a lung cancer in stage 4, small cell carcinoma lung will have a possibility of 17% 5-year survival. This is according to the SEER. Now, SEER is a agency which tells what is the survival rate in America. For a small cell carcinoma, it is 7% survival at 5 years if you have stage 4. So the mortality is very high, and the drugs are very expensive for these diseases. So if you are treating somebody with lung cancer, and if you want to give them the best treatment, the treatment can go in crores. So one, you have created a disease and you're paying for it. So you're paying to create it, and then you're paying to treat it. So that is one thing I want to say, that, this awareness are important, because the person who gets into it, can spend the entire fortune and still may not be cured. If you have to give you an example, if somebody is getting treated with immunotherapy for lung cancer, the treatment may be somewhere between 50 lakhs to 1.75 crores for the treatment over a period of 2 years, and which may be still not guaranteeing that patient that he will be cured. So that is the kind of scenario one needs to look at. Next slide. So this is the distribution of lung cancers in major cities. And as you see that it is in some areas more like Manipur, Imphal, Mizoram, because the smoking patterns are different there. They smoke more. And the chewing pattern is more in Mumbai, Chennai, Ahmedabad. So you have chewing tobacco creating oral cancers, and you are smoking tobaccos creating lung cancer. That is what is being seen from this. Next slide. So this is the trend in major cities, Bangalore, Chennai, Delhi, and Mumbai. You see that these are the graphs, and we see that they are almost stable over last 20 years. Or in fact, in some areas it has gone up in Delhi and Chennai. Next. So the farmers, laborers all have different patterns of lung cancers, again related to BD smoking. And there are multiple, shutta, you have hookah, you have cigarettes, you have pipes, multiple ways of smoking. Next slide. So the risk factors for lung cancer, there is no direct link, but smoking is the most important reason for lung cancer. The second-hand smoke being the second one. Radon gas, this is not being tested in India, but in America, they tell you that whether your house has a radon, how much is the radon in your house before you buy the house. So maybe in future, when you buy your house, you should speak to your builder and ask him for a radon gas testing in that area, because there may be soil releasing radon, which may be also harmful to lungs as well as creating lung cancer. Asbestos and other things which can be, again, as we know, asbestos sheets are being used at insulation of house. So these are the, they release certain substances, and people who work in asbestos factory. If you have family history of lung cancer, that also increases your risk of cancer. Using excessive alcohol. If you had any previous radiation therapy, if you are working in areas of nickel, chromium, arsenic, all those things also can lead to an increase in lung cancer. Next slide. So you have non-small cell lung cancer, which has actually 4 types: adeno, squamous, large, and NOS. And there are 52 subtypes to adenocarcinoma. And each one has, like, there are various subtypes who have now targeted therapies. Like if you have an EGFR positive, ALK positive, ROS, RATE, MATE, BRAF, PDL1, HER2, many of these. And they have particular drugs for particular type. So if you have an EGFR positive, you have different class of drugs. You have TKIs, tyrosine kinase inhibitors, and they can lead to, even in stage 4, a 47 months survival. If you have an ALK, there can be a 90-month survival only by a tablet. So there are good drugs which are being available now, but then they are not for every subtype. They are for some subtypes. So we have only 7 or 8 subtypes which are right now being treated. But some subtypes like exon 20, we don't have a drug called amivantamab, which is costing 10 lakh rupees a month. So if you want to survive, you need to be on that drug, which is very expensive, not available in this country right now. Next slide. Staging, basically what we do is we must understand that there is one typing, which type of cancer it is. Second is staging, how much is the extent of disease, like whether it is localized, whether it is regional, whether it is metastatic, gone outside. And the third thing what is important is grading, whether your tumor is grade 1, grade 2, grade 3, whether it is differentiated or undifferentiated. Most of the small cell cancers are undifferentiated, so they are high grade. Most of the non-small cell cancers, if they are having a target, then they are differentiated. And if they don't have a target, they are poorly differentiated. So grading, staging, and type. These are the three things which have to be, which are like a deciding factor for an outcome of a patient. Next. So if you look at the survival in early stages, these are, I think, the old survival things. They are better now. They are like 63%, and the stage 4 is 17%. We have better survivals in view of more targeted therapies and immunotherapies available to us. And these are 2016 review. Now 2022 will get the 21 outcomes. So which will be better. So every 5 years, we are becoming better in the outcomes of lung cancer. But they are improving because we are getting better drugs. But are every fellow citizen of this country affording this kind of treatment? That is the next question. So the easier option is education. Rather than having better drugs, you can avoid a disease. This disease, as I said, is totally preventable. You don't have to do anything major. You just have to sit back and understand what wrong things you are doing and revert them back. And there is a great possibility, even if you are a smoker and you stop smoking today, your risk in the next 5 years will drop by 40%. In next 10 years will drop by 60%. In next 25 years, you will come down quite close to normal. You will never become normal if you are a smoker. Next slide. So, yes. What are the clinical features? Basically, if you have got a cough, which is going on for more than 2 to 3 weeks, and if it is not an infection, if it is not having fever, if your things are not settling down, if you are coughing blood, if you are feeling breathless, if you are feeling tired, if you are getting weight loss, if you are getting bone pains, headache, hoarseness of voice, please do consult your doctor and try to get imaging done, because there may be a simple, even an X-ray will tell you what is there in your lung. So you need not do a CT scan, but if you are a heavy smoker, if you are smoking 20 cigarettes a day for last 20 years or 30 years, then you may even require a CT chest to understand what is happening in your lung. Next slide. So treatment basically depends on where the disease is. Whether it is local, then you may have to go for resection of the disease. And if it is regional, then you may go for chemoradiation followed by immunotherapy. And if it is distant metastatic, then you need to understand the type of the cancer, the type of target available to you. And then you decide whether you go for chemotherapy, chemoimmunotherapy, or targeted therapy directly, or you change once you get the report. So there are a lot of combinations possible in this scenario. And we need not go in details of those treatments because they are very exhaustive. But yes, there are a lot of treatments available. Earlier, when I joined oncology in '94, we used to get a diagnosis done and then tell the family that, okay, you have got a lung cancer. So we knew the cause of death. There were no treatments available. The treatments were very difficult. There were chemotherapies. They were just making a person survive 6 months in those days, in those era. Now we are talking in terms of years, and some patients are surviving lifetime normal thing with immunotherapies available to us. So things have changed a lot. We have moved in last 25, 27 years significantly. But it comes at a cost, and the costs are prohibitive. So they, even your money will be short. Your insurance may not be able to cover you. You may have to do 3 to 4 types of insurance to cover for lung cancer treatments. If you want to go for the best treatment, you may require 5 or 3, 4, 50 lakh rupees worth insurance on a personal basis to get yourself covered. If you want to go for a right kind of treatment in a full blown treatment. Next slide. So in early stages, what we do is we do their lobectomy, which can be done by endoscopy, when we call it video assisted thoracoscopic surgery, VATS. You may do a VATS lobectomy, you may do a VATS pneumonectomy, you may open up the lung and do the surgery. You may be doing various ways of doing surgery. Let's not go in details of that. Then you have some patients requiring surgery followed by chemotherapy, some people requiring surgery followed by radiation and chemotherapy. In some patients, we directly go for radiotherapy and chemotherapy followed by immunotherapy. And in stage 4, as I said, we go according to the targets available to us and we treat them based on that. Next. So, role of clinical trial. There is a huge scope of clinical trial in lung cancer. To give you an example, right now we are doing a study on exon 20. The drug is not available in India, but it is available at 3 sites. And one of the site being my site, where we have this drug, and a patient would get the drug free of cost till the time they survive. So, which may be costing in crores. So, a year of treatment may be 1.2 crores. So if you are going for 5 years, you can imagine the cost of the drug. So that is the kind of clinical trials. Don't think that in oncology, they are making you guinea pig. In fact, they're giving you something which you can never dream of. So if you get a chance to get enrolled into a clinical trial, just make sure that it is not a placebo. You're getting a drug. If you're getting a drug, you may be getting the best of the drug because the companies are trying to come up with this drug. They want to market it. So they want initial reports to be submitted. And that's the reason you're getting it free. You're giving them something, they're giving you something. And that something can be great. In fact, to give you an example, one of the patients 10 years back received a vaccine at our site for lung cancer. He was a stage 4 cancer, a farmer from remote place in Maharashtra. And he was that time around 65. So his son thought that, anyway, he's not going to survive. People had told him, stage 4 lung cancer, 3 mahine ki baat hai, kyun le jate ho? So he came here, we gave him the treatment, we put him on vaccine. It is 2021, he is alive. He got the treatment free, he is working in farms. In fact, when his photo came in one of the newspapers in Pune with his son, people thought that his father was more fit than the son. So this kind of things can happen. So miracles do happen and they can happen only when you try your luck. You don't get miracles without trying a luck. So if you don't have a right drug, like to give you an example, there is a KRAS mutation, which has got a drug available since May 2021 in the world by the name called sotorasib. But this drug is costing more than 20 lakh rupees a month. And there can be 10% of patients who may have KRAS mutation positive in their lung cancer, which is telling that your lung cancer is very bad. So if you want to survive, you need to get this drug. If you need to get this drug, you need money. So this is how the situation is. So definitely companies like Alkem should come up with innovative ideas to create more generic drugs in the country so that, we have a better availability to a patient, or at least tie up with the foreign nationals so that you get this drug at a cheaper price in country. So that is my suggestion to even Alkem, that you should come up with this. Can we have the last slide? The most important thing is prevention. There is nothing better than prevention. Prevention is always better than a cure. That is the dictum. You should never create a disease and then treat it. Quitting tobacco is the first thing you should do. Avoid secondhand smoke. Eat a balanced diet with a lot of vegetables and fruits. You should avoid chemicals at work. You should avoid the radon. You should avoid the chemicals in your pesticides in your food, your arsenic in the water. You should avoid things which are avoidable. And you can avoid cancer to a larger extent. You should do exercise on a regular basis. Exercise means run, cycle, climb, dance, where your heart rate goes to 120 to 150. That is moderate intensity exercise, 150 minutes a week. That is what is recommended. If you are doing a vigorous exercise where your heart rate goes to 180, you can do 75 minutes of that. But then only the best of the athletes can do this kind of exercise. So I would not recommend it to people who are otherwise not doing exercise on a regular basis. You should go for a moderate intensity exercise. Walking is not a moderate intensity exercise. It's a mild exercise. If you walk 1 hour, you are losing somewhere around 120 to 160 calories. You eat one chapati, you may get that back. So what happens is people walk for 1 hour and then 23 hours they are sedentary. And they eat on the basis of their walking throughout the day. So they feel that I have done something great and they just are happy to eat throughout the day. So 23 hours of sedentary lifestyle, sedation also mentally, sedentary sitting wise, and then doing this. So a lot of companies now have come up with an innovative idea that no chairs. You should be always moving. And I know professionals have to sit and CAs have to sit throughout the day on the computer just looking at the accounts. But my suggestion is whenever you get chance, get onto your cycle, get onto your treadmill, or climb at least 3 floors every hour, which will take you only 2 minutes. 30 floors a day can change your life. Take a lift down, climb up. And I'm sure most of you will be working in buildings which are quite tall. So that can be an easier solution during your working hours. And you may see things on phone if you want, if you don't want to waste even your 3 minutes. Thank you. Thank you. I can take some questions from you people if you have any.
Yes, sir. So one question is there, sir. So how many cigarettes in a day and for how long would causes the lung cancer in future?
See, there should be never a cigarette in your life. If you are not a smoker, don't think how many cigarettes will cause cancer. So let me try this and let me prove it to the world. But definitely you should have smoked less than 100 cigarettes in a lifetime to call it a non-smoker.
So next question. So what are the warning signs that a person should evaluate or screen for lung cancer?
See, I told you, anybody who has got cough, which is going on for 2 weeks, if you're bleeding through your cough, if you're feeling breathless, if you're losing weight, if you've got bone pains, headaches, you may have a stage 4 cancer. You never know. 80% of lung cancer get detected only in stage 3 and stage 4. So, it is the last thing one should ever imagine. But you should not be unnecessarily pulling on things. So you may have, if you are a smoker, to give you an example, if you have somebody in the family who has got malignancy, lung cancer, then your chance of getting cancer actually doubles. If there are 2 people in the family, then your chance of getting cancers are triple. If you are a smoker and somebody has got a cancer, then your chances are 50% straight. The reason is multiple. One, you may be sharing genes with your siblings. Second, you may be sharing the smoke area in the same building you are living, or you may be sharing the same radon, the same pesticide, the same food. So you are at a higher risk. So this kind of people who are smoking 20 cigarettes a day for 1 year is called 1 pack year. So if you are smoking 20 pack years and you have a family member, you are age 50, you should undergo a CT chest screening. If you are smoking 30 cigarettes a day, 30 pack years, and your age is between 55 to 75, you should undergo screening with CT scan to rule out. If you do a screening scan, the chances of your cancer risk death goes by 20%. So early detection leads to a 20% better survival.
The next question. So I am non-smoker. Does that means I won't develop lung cancer?
No, that is not correct. That only smokers will get it. 20% of non-smokers get cancer. In fact, a lot of females who are coming with adenocarcinomas age less than 50 are actually never smokers. But we are seeing the rise because of urbanization. See, the biggest disease, as I told you, is the urbanization. The way we have changed our lifestyle, this is what has created more cancer. To give you an example, if a person is eating Indian diet, then the prostate cancer risk in India for that person will be 30 times lesser than Americans. The moment this person moves from India to America, his prostate cancer risk is like the Americans. Okay. Breast cancer, the risk for Indian women is 10 times less than Americans. The moment this female moves to America, the risk is like the Americans. Okay. So 6 in 1 lakh prostate cancer in India, 130 per lakh in America for whites, and 1 in 80 prostate cancer for American blacks. Now this rise is because of food. Okay. The second thing, what we are saying is that obesity. A lot of urban population, we are doing a study at our center, and we see that 30% of females are obese, and they don't even realize this. They say, "मैं तो पहले से ही ऐसी थी." So see, they are taking it so casually. Healthy means not hefty. Healthy means you can climb 30 floors. That is healthy. But we have taken health as being fat. So health is not being fat. That we must understand. If your height is 160 centimeter, your weight should be 60 kg. If you are, for a male, it may be 2-3 kgs, 4 kgs up. For a female, it should be actually 2-3 kgs low. If you are into this category, your BMI is between 20 to 25. 30% people who are coming to us, patients who are coming to us, are actually overweight. 30% are obese. They are going beyond 30 BMI. So, as I said, by weight alone, you are creating 30% of your cancers, 20% of your cancers, 30% of cancers coming out of diet, 50%, 30% coming out of tobacco, 5% coming out of sedentary lifestyle. So 55% cancers, you don't require anything. You just require to be sedentary, not doing exercise, becoming obese, and eating junk, eating outside food, eating processed food. That leads to a significant chunk of cancers in our country. Then comes the air pollution, then comes the water pollution, then comes pesticides. Everything is creating only cancer. There are only 5% to 10% genetically linked cancers. The rest are all created cancers.
Thank you, sir. Next question from Mr. Praveen Kote. So, is there any chance getting lung cancer by passive smoking?
Yes, I said 50% of people are at risk of second-hand smoke. So, if you are doing a second-hand smoke, you can be at risk of cancer. Plus, you may be sharing the same food, same other things also with them, the family members. So that is where the thing should be, that you should avoid second-hand smoke also. It creates a significant number of people get this cancer.
Thank you, sir. The next question, sir. If there is a family history of lung cancer, so what are the chances of developing lung cancer in me?
Lung cancer, as I said, if there is one member in the family, the risk is double. If there are 2 members, the risk is tripled. If you are a smoker, then it gets even more.
So, can I prevent it? So, the next thing.
Definitely, this is the most preventable thing. I told you, if smoking is gone out of the world, 90% cancer will be gone out of the world. There are 1.6 billion people right now smoking in the world. 1.6 billion. 1.3 billion during the COVID time actually thought that we should give up on smoking. 70% of patients, 70% of people were having an access to quit smoking program. A lot of people in our country don't know that there is a quit smoking program existing in the world. So quit smoking means they help you with support groups, they give you alternative treatments so that you lose this habit of smoking. And a lot of countries, Denmark, Canada, America, they have realized the importance. So their smoking rates are coming down and the smoking is going up in Asian countries. So India, it is becoming a style. All our actors,
I think there are some connection error.
I think link of Dr. Manish has lost.
Yeah, yeah.
Okay, some technical issue.
Class. So, it's situation is bad. So you can prevent it. You can prevent it by good food, good exercise, avoiding certain things, as I said, smoking, second-hand smoke. You can avoid it. You can check your radon in your society and see what is the exposure. But anyway, if you are living in that area for a long period of time, you might have been exposed. If you're buying a new house, it makes sense in looking at radon.
Yes, sir. Some next question, sir. So, where a patient can find information about the clinical trial for enrollment in lung cancer?
There is
or
a
other
site
cancer?
called CTRI, Clinical Trial Registry of India. So you'll find that, CTRI, if you go on to CTRI, you'll get the information.
So in daily life, so many toxic chemicals are there in environment, as you mentioned actually. So how we can take a precaution, and how in future actually, so how we can avoid this toxic chemical in environment?
If you're working in any of this beryllium, cadmium, nickel, asbestos, there are gears available to you, which you should do that. You should avoid second-hand smoke in your work area. So you should not allow somebody to smoke.
Yes.
That is second thing. So offices can ban smoking. Restaurants, you should not visit a restaurant who is allowing smoking. So you should go to a non-smoking this thing. And plus you should stop smoking.
Yeah, mask can prevent this.
Mask may reduce your smoke exposure, but it cannot stop it. You cannot be in mask throughout the day. So if somebody has smoked in your house and you sleep at night, would you be wearing a mask? So it's not that 24 hours you can wear a mask to filter out the carcinogens. It's not possible. You may reduce it down, but you cannot stop it. It's better to do healthy ways rather than using a mask. See, that is what I'm trying to say. You create a disease and then you say that we have got better drugs. You don't allow a disease to happen. A lot of money will be saved just by doing this. If you imagine that there are 75,000 people getting lung cancer and they are spending somewhere around 10 lakh rupees, let's put it up this way, on their treatment per patient. How much is the revenue lost by this country into some other country? So if you are a nationalist, you should not be looking at allowing this money drain.
So next question from Prashanti from USA. People who having lupus, are they prone to lung cancer?
Lupus?
Yes.
No, not really. That lupus, and there is no link, but there are links between Lynch syndrome and BRCA1 and 2 genetically. Lupus is an auto antibody. Our body is fighting our own cells. Here in cancer, our body is not understanding our own cells. So there is a difference between the two. So there is no direct link, but definitely treating a lupus patient with immunotherapy is very difficult. You can't use an immunotherapy in lupus patient with lung cancer. So that becomes a challenging issue.
Next question from Ritesh from Patna. So what would be the effect of pranayama? Control breathing.
Definitely, if you are healthy, see, it is like this. How do you create cancer? You're creating it by putting more, using less. So if you have too much of money and you stuff it down and you die without using it, what is the use? No use. Your body, you should remember, very simple Tibetan rule. Eat half, exercise double, and laugh triple. That is the simpler thing. Now, when I say pranayam, if you run, your pran is going to be yam only, in and out. So when you run, when you cycle, it is already pranayam. Pran is life, yam is death. So in and out is automatically happening. You don't have to do only pranayam. You can do pranayam, but you need to do something. You must sweat. If you don't hear your heart sounds, which is the best music in the world, then you have done nothing. So you must run so that you get your thumping in your ears. And that is what is exercise. You must sweat so that your head to toe is drenched with your sweat.
Next question from Mr. Sandeep from Ranchi. Sir, after being infected with second wave of corona, is there increased chance of lung cancer?
Lung cancer and COVID, we do not have any link, but definitely if you are having COVID, there are a lot of times what we have seen, patients got admitted at our center saying that they have got COVID. But when the scan was done, there were images which were confusing. Later on, it was a lung cancer, which was creating breathlessness, which was never a COVID, or it was a mild COVID in the blood. The scan was lung cancer, so there can be a confusion. So it's not COVID creating lung cancer, but it can be a confusion between lung cancer and COVID.
So next question. So can stress causes cancer?
Stress directly is not linked to cancer, but people who are in stress, they go to relieve their stress. They smoke, they drink, they eat, they don't take care of themselves. They live a sedentary lifestyle. They don't exercise. So these are all the reasons of cancer, what we found. So stress may not cause cancer. So it's not like somebody has got in stress and got cancer. But stress leads to various mechanisms, which are all at risk of cancer. So stress is an indirect factor of cancer promotion. Or poor treatment also. People who get into cancer and get stressed, they don't get treated properly. So their outcomes are poor.
So after how many days my lung become normal after I gave up a cigarette?
See, your lungs, if you are a heavy smoker, will never become normal. Even after 25 years, there will be threefold risk of lung cancer in a smoker. Even after 25 years of giving up. At 10 years, 50%. At 5 years, 40%. Risk reduction.
Yes. Sir, this will be the, I think so we are reaching to the 6th. So this will be the last question from Mr. Sandeep Jalan from Ranchi. Are there any preventive checks available to detect various cancer at early stage?
Not really. Basically, as I said, only high risk people we are screening right now. For high risk, certain diseases like, cervical cancer screening helps. For lung cancer, high risk people, it helps. For prostate cancer, high risk, if there is a family member, it helps. But you are not to do, and a screening never says that, your scan may be normal today, but that does not guarantee you for the next 1 year. You may repeat a scan after 1 year. So doing a scan does not mean that I can go and do whatever I want. My scan is normal today. So that is not the way. You can't screen. You have to be vigilant. You need to be aware that if there are symptoms, it's better to be taken care immediately, evaluated, and face it as it comes. Don't get afraid. Your cancer is not bigger than you. You can definitely win, and you can definitely knock it off, provided you are mentally composed to fight it out.
Thank you, sir. So this is the last question. So thank you very much, sir. And over to Mr. Praveen Sharma.
Thanks a lot, sir. Indeed, it was a wonderful session, and I must guarantee that most of the members are enlightened, and they are like the fear of cancer is somehow reduced. We can prevent it for sure. And now I would like to request our past chairman, C.S. Sandeep Jalanji, to present a vote of thanks.
Thank you, Praveen sir. A very good evening to all of you. It gives me immense pleasure to deliver the vote of thanks for this event to all the dignitaries present here. We would like to thank our speaker, Dr. Minish Jain, and a panel of doctors. Sir has given a very knowledgeable content to all of us. Thank you, sir. Thank you for your valuable words. We would like to thank our Central Council member, Manu Agarwal, sir, Regional Council member, Nilesh Gupta, sir, for giving their valuable time. We would also like to thank our more than 1,500 beloved audience for making this function a grand success. We would like to thank our Public Relation Committee of ICI for giving this opportunity. We would also like to thank Vinay Vibhakar sir for helping us in organizing this webinar. Last but not the least, thank you the Zoom platform for uninterrupted session. I would also like to thank Mr. Abhijit Najare for giving his valuable time. Once again, thank you all of you.
Thanks a lot, sir.
Thank you.
Can we
Thank you.
share
Thank
this PPT to our members, sir?
No problem. Absolutely. Anytime. There's no, in fact, you can also quote that we have, I have actually two things. I have Cancer Ki Baat, Dr. Manish Jain ke saath as a podcast, which is a Hindi version where we discuss not cancer statistics. We discuss what is cancer, how do you manage it, how do you live with cancer, how do you treat a cancer, what do you do to avoid it. So it is basically a dialogue, which is Cancer Ki Baat Dr. Manish Jain ke saath. And we have another YouTube channel, which is Cancer Talks by Dr. Manish Jain, which is only on discussing what are cancers and their risk factors and how to diagnose them and how to treat them. So we have these two things. One is a YouTube and one is a podcast. So if anybody wants to log into that, then definitely do that, and it will be quite a good information. And every month we have a YouTube session. On yesterday we had one where we had 5,000 people attending Facebook for cervical cancer, which is again 100% preventable cancer. And we are the second largest in the world to get cervical cancer in this country. So we create and then we try to, we are trying to promote education as a reason to avoid cancer for most of the people. But you know, cancer is a word which people don't want to accept. कि वो तो मुझे होगा ही नहीं, ये हमारा पहला होता है, मैं क्यों सुनूं, ये मेरे लिए तो है ही नहीं. See, everybody of us is at risk. That is what I'm trying to tell you. And nobody is an exception. So we need to understand today to avoid it tomorrow.
Thanks a lot, sir. Thank you very much.
Thank you.
Thank you. Thanks all.
Praveen sir, we have arranged bouquet as per your request. So,
Sir, please, that would be a great help for us and honor for us.
Okay.
So this is just a token of love and
Thank you so much.
gratitude for you, sir. Thank you very much.
Thank you so much. Thank you.
Thank you, Dr. Jain, for this insightful lecture.
Thank you. Thank you so much.
So we at ICI give memento in form of books only.
That's great. In fact, knowledge is bigger than anything.
So we believe
let's hope that I get enlightened with this your book. Thank you.
Thanks a lot, sir. Thank you very much.
Thank you, sir.
Hello. Okay.
Thank you, Praveen ji.
थैंक यू सर, आप लोग के हेल्प के लिए बहुत बहुत धन्यवाद, और वी होप कि वी विल कीप डूइंग these webinars in future also. Thank you, Ritu ma'am.
Sure. Thank you. Thanks a lot. Bye.
Thank you, sir. Thank you.
Can we close the session now?
Hello?
Can we call off the session now?
Yeah, sure. Yes.
Thanks a lot.
Thank
ma'am.
you, sir. Thank you.
Recording stopped.